Well, hello, and thank you for joining our webinar today. My name is Tom Seco, and I'm the Business Development Manager with DAS Health. And I'd like to welcome you to our webinar about automating multiple encounters in NextGen with our Multiple Encounter Billing Manager software. First of all, I'd like to say that the webinar is going to be recorded, and that we'll send out a copy of the slides and a recording of the webinar within the next week. Everyone's phone will be muted as we go through the webinar. So if you do experience some audio issues, please use the chat box and let us know so that we can resolve any issues that arise with regards to that. Before we get started, I have some exciting news to share with all of you. I'm sure you probably know by now, iTentive is now part of DAS Health. DAS Health is a leading provider of health IT management solutions, and we are a trusted consultant to many physician groups, hospitals, and healthcare systems across America. The merger took place on November 1st of last year, and by combining our skills and our expertise, we will be able to provide even more support and value and solutions to your practice or and health center. So what does this mean to you, our clients and our prospects? It means that our portfolio of what we can provide has become broader and deeper. It means that we've gone from 40 employees to now 200 employees. It means that we have worked with over 400 clients that use NextGen. But some things remain the same as well. Our passion remains the same, and that passion is that we want to work with our clients to improve patient care, work with our clients to enhance the patient experience, and work with our clients to maintain a financially healthy practice. Our mission remains the same as well, and that is to create additional value for your NextGen investment. We know when you purchased NextGen was a major purchase, and that investment probably has grown over the years with regards to additional hardware upgrades, things like that. So we as an organization want to work with you to get as much value out of that investment as possible. And what also remains the same is that we are continuing our strong relationship with NextGen and continue to specialize in NextGen and keep our focus on you, the client, the prospect, to help get as much value out of NextGen as possible. And we remain here to help you and serve you in any way that we can. Before we get started, I'd like to take a little poll. And what we'd like to do there is have you select something. So I have a couple questions to ask. One is, when multiple encounters in NextGen are needed for a single patient visit, how many are typically needed? So if you could select whether it's 2, 3, 4, or 5, or 6 or more encounters when you're doing this, that would be great. And what I'll do now is give you 5, 4, 3, 2, 1 before I close the poll. I'll go ahead and close it. And I'll share these results with you. So as you see, 83% of you say you do 2 encounters when you have to enter in multiple encounters for a single patient visit, and 17% are at 3. So thank you. The next one is, for what purposes do you create several encounters? So for what purposes do you create several encounters? Professional fees, facility surgical fees, anesthesia, specialized diagnostic equipment, procedures, durable medical equipment, or others. You could select as many of those as you are appropriate. And I'll give you a couple more seconds. And that'll be 5, 4, 3, 2, 1. And I'll go ahead and close the poll on that one. And let me share those results with you. So 71% of you say that you have to enter in professional fees, and 14% have to enter in facility and surgical fees, 29% special diagnostic equipment, and 14% durable medical equipment. So thank you very much for doing that with us. It's good information, I think, to share with everybody, kind of see where everybody's at. And so we'll go ahead and proceed with the presentation. So back to today's webinar on efficiently processing medical record requests for things such as insurance audits and legal requests. As I mentioned, at the end of the presentation, we'll open up the floor for questions from you. We'll answer any questions that you have. You can type them in the questions area of the webinar control panel whenever they may occur to you. And like I said, we'll answer them at the end of today's webinar. And again, reminding you that for auto clarity purposes, everyone's phone will be muted throughout the entire webinar. And again, if you experience any issues with the audio side, please enter that into the chat box and give us an opportunity to resolve it. Introductions, again, my name Tom Seco. I'm the Business Development Manager with iTentive. I'll be your host today and do a little bit of presentation. With me on the webinar is Joel Scholes. Joe's our Product Solutions Director. He and his team developed the Multiple Encounter BillingManager software. He's going to take you through a demonstration of the product as well. The agenda, what we're going to cover today, we're going to, like I said, give you an overview, go through a live demonstration of the product, and then answer any questions that you have. So a little bit of overview about the product. Multiple Encounter BillingManager software is a product that we created from a request from our clients. These particular practices had the need for creating several encounters for a single patient visit, and were cumberously going through multiple screens to complete the work. So they asked us, is there some way that we could make it more efficient for them to process that work? And that work being, let's say you have a procedure and you have to typically enter in, as you showed us in the poll, professional charges, anesthesiology charges, and surgery center charges or facility charges. Typically, you have to go through multiple screens to do that, to enter in each of those charges. So what the BillingManager software does is it allows you to enter those charges in from a single screen, and allows the software to distribute those charges to the appropriate areas within the NextGen system. So it creates much needed efficiency by significantly reducing the time it takes to do that work. So with that, I'm going to turn it over to Joe, and Joe is going to take you through the demonstration.
Thank you, Tom, and thank you everyone who's joining us. We're going to go ahead and switch screens here real quick, so you may see a bit of flicker as we move into our demo environment. If you have any issues with the demonstration or it doesn't seem like the screen is keeping up with what I'm talking about, please let us know in the chat window and we can kind of adjust what we're doing to accommodate. But normally it works great, so that's the good news. All right, so let's jump in and see how the BillingManager works. As Tom mentioned, this is a tool where you can enter in several encounters for a single patient visit on a single screen without having to jump between NextGen or have multiple NextGen sessions open. When we install this, we go ahead and register it into your add-ons menu in NextGen Practice Management. So we'll see up on top here, we have BillingManager. Only the people in the appropriate security groups in NextGen will be able to see this and launch it. So I'm going to go ahead and bring this up. And as we saw in the picture on the slide, the screen is really straightforward. The operation of this is really straightforward too. But what I want to do before I show you how it's used is talk to you about how it's configured. The scenario we have set up in our demo environment is for ophthalmology. And when we were gathering those statistics earlier, we saw that some of you have the need for professional fees, facility fees, specialized equipment, DME, so on and so forth. So we can set up different categories of encounters that you need to create. All right, so again, this one is set up with more of a ophthalmology focus in mind with the A-scan machine here. For this particular client, they're going to start with one encounter that gets created normally when the patient checks in at the desk. And in their case, it was going to be the encounter for the professional fees. So basically the clinic side encounter that would get created. And that'll really become what we call our base encounter. It's the template that we're going to use to create all the other encounters. So we're going to look at that for things like which providers rendering referring, which insurances to use, that type of stuff. So if I look here on each line in the configuration, I can take you through what's going on. So as mentioned, we're going to use the clinic as the base encounter. Now, for some people, it might be the surgery center that's the base encounter. It's just a matter of ticking the right checkbox. Additionally, we're going to try and match up the insurance on each of these. All right, so that they're all going through the same insurance by default. And then we can also say whether they're required or not. So we can set a minimum and maximum number of encounters. Normally it's going to be 1 and 1. You might have some cases where it's 0 and 1. And the 0 just means it's optional. Like for example, in this case, we're not going to use the A-scan machine every time. All right, and then we could set this at 1 or 2 or some maximum number of encounters that we'd create here. If we weren't using the base encounters insurance, we could go ahead and use the last encounters insurance and try and pull that forward too. But normally, because you're going to do that when you create the base encounter, most often we're seeing practices want to match that encounter's insurances. And then also for the base encounter, you're going to designate who the rendering provider is and probably who the referring provider is. And then we can take those values and map them down onto the other encounters. So for the A-scan machine, we're going to keep the base rendering as the rendering because that's in the same practice and we'll keep the same referring. But then when we go down into the surgery center, maybe the surgeon's different than the clinician. So in which case the rendering might become the referring. So we have the base rendering in the referring column, and then we'd put in a new provider over here for the surgeon. All right, so just some different options that are available. And of course, you probably want them all to have the same data service so that they bill properly. So we'll go ahead and use the same base date. So again, on this base encounter here, whatever data service that has, the other encounters will have that data service too. And then if you have a bill hold date set up, we can propagate that down too. But the key is we're going to use that encounter created at check-in as the template to create these other encounters. So you don't have to go enter insurance again. You don't have to go change in the data service. You don't have to take care of that stuff because the system's going to do that for you. So as part of the setup and configuration of Multiple Encounter Billing Manager, we'd work with you to build out this screen. And in some cases, you might have 2 lines in here. I think we saw one of you had, or a couple of you had 3 encounters that would get created. So we'd have 3. The system will do up to 4 different types, or actually up to 7 different types of encounters. And we could expand that number if needed, but right now the most we've run into is 4. So that gives us some breathing room for now. So that's the configuration. This is the part we do at the beginning, and then you really wouldn't go back to this if it's doing what you want it to do. Now, the charge staff is going to work with this tool instead of jumping around NextGen, and normally they're going to have some type of report they're working off of, and that may be in NextGen, they're looking at the base encounter, it may have a paper report, but either way, they're going to want to pull up the patient that they're going to work on. And if they know that encounter number, they can simply type in that encounter number and start the process. If they only know the patient's name, you can do an encounter search, pull up the list of encounters, and then pick one of those. But for today, I'm going to go ahead and pick the encounter that we want to work on. So this is 1209. It has our encounter in here that was created at check-in. Our rendering was Charles Cook. Here's our service item that's on here for the charge. So what we're doing here is taking the most important fields from the encounter form and the charge form in NextGen and fitting them into one screen, fitting them into kind of this hierarchical grid format here. so that we can go ahead and do these things without having to jump around between different screens. So this is our base encounter information. Now for some of you, this charge may be here or it may not. You can go ahead and add a charge here. If I look over here on the right, I can see the status is enroll, which means the encounter exists in NextGen, but it's not part of the set yet of encounters that we're going to create here in Multiple Encounter Billing Manager. Now we see these other encounter groups that we were talking about earlier. So if we want to create an ASC encounter now, we can either right mouse, add new encounter, and pick one of these, and these labels all change based on the configuration. Additionally, we could come down here and just do Control-3 if we wanted to keep our hands on the keyboard, and Control-N if we wanted to do a new charge. So we'll do our ASC. We can see that the way we had this map, our rendering here came down to our referring here. So we can go ahead and pick different values. We can go ahead and let me pick one of my providers. So we'll pick Bruce here to be the surgeon. And then I can either use the mouse or Control-N to do the charge. Now this again is all of the important charge fields from NextGen. So it's also smart enough to bring down the diagnosis codes, and the procedure comes off that, and you can override the price just like you can do in NextGen. As we tab through this, the header, the appropriate header is highlighted. So sometimes people look at this and go 7010, that's NDC. No, it's actually the service item. So we highlight that just because there's 4 rows of information. So there's 4 rows of headers. And we'll see that a little more in a second when we go ahead and enter an anesthesia charge. Now on the status for these ones, we'll see that it's insert. And that just means that this is only in memory right now. Nothing's been done in NextGen yet. We've put the values in here that we want and set them, but we haven't told it to go create those encounters and charges yet in NextGen. And we'll have it do that in just a minute. In fact, we can also see, there's no encounter number yet for that reason. So now let's go ahead and add another encounter for the anesthesia. So instead of using the mouse, I'm going to do a Control-4, and that's going to add my anesthesia encounter, so it goes under that header. And again, we can go ahead and tab through, pick our values, and we can do a new charge. So again, just makes it real efficient if you're trying to keep hands on the keyboard. And then we can come down here for our anesthesia and say what time we started and stopped, and it'll respect all of the rounding rules that you have set up in NextGen based on the insurance that's picked. So you can see it's 71 minutes total time. There's no base units here. The time base and anesthesia base come out to 5 units, and then it'll do the calculations. And if we wanted, we could go ahead and override this. We've worked with some groups that have kind of a fixed rate they use for anesthesia instead of a time-based rate. Gives you the ability to do that. Also, if you need to add additional diagnosis codes for these other charges that weren't necessary on the first charge, you can go ahead and add those here too. All right, so now that we've got this built, and again, this is an insert, so it's still in memory here. It's ready to be inserted into NextGen and is part of this set. So we have our base up here, and we have our 2 new encounters with charges here. Well, all we need to do is go ahead and click Save, and it'll create those in NextGen, and then we'd move on to our next set of encounters we're going to do for our next patient. Now, what I want to do here real quick is just take you through and show you what was created. So I just pulled up these same sets that we were looking at, and I can see here's our encounter number for the surgery center, and that's in our Peachtree Surgery Center practice. So I'll come over here to practice management. And again, this is just to show you, normally you wouldn't even bother with coming back here, but I want to show you the work that's been done on our behalf. And we can go ahead and pull up that encounter and see what was created on our behalf. So we have the encounter here. We have the charge that was brought down. We have the insurance that was brought over. from the template. So that's the insurance that was in the base encounter. So all that happened for us automatically. So the whole point of this tool, again, is to save you all those steps of bouncing around between various forms, switching practices, having to rekey things, having to repick insurances, all that, and it really streamlines the process to be a fraction of the time that's required to enter several more encounters in NextGen for these complex patient visits where bills have to go out to multiple entities, potentially even in multiple practices in your database. I'm going to go ahead now and turn it back to Tom, and we'll finish up and take your questions.
Okay, thank you very much, Joe. So as Joe mentioned, what we'll talk about is as far as next steps, we'll go ahead and send out a link to the recording so you have that. And then if you have any other additional questions that come up after today, you can give us a call or send us an email, and we will get you the information that you need. And with that, we'll start taking any questions that you might have. You can enter them down into the chat box. So here's one question that came in. What is the training process for Billing Manager?
The training process for Billing Manager is very straightforward. As you see right here, it's easy to use. It's just a matter of pulling in the information that you're looking for. So we'll give you a user guide, we'll give you a training video, we'll get this installed in your test environment, and then we'll set you loose to try some things, and we'll be available for a Q&A call. Once you're confident that everything's configured as you need it, we'll go ahead and work with you to get that moved into production. And again, you'll start out doing several of these, cross-checking them, and then move forward in volume from there. So Attentive/DAS Health strategy is to hold your hand through the process to make sure that when we're done installing, you're able to adequately use the tool and you're happy with the performance gains you're getting from it.
Thank you, Joe. Here's another question. We are hosted by a third party. How does that affect the installation process?
Mm-hmm. We've worked with several third parties in the past. Most of the major hosters of NextGen that are out there, normally they have a form that we fill out about a third-party application. So you'd follow that process with your hosting provider. And again, we'd work with them to go ahead and coordinate the install, and their technical people will go ahead and run the configuration for us, and then we'll build it out with you. So we'll work with you whether you have NextGen in-house or NextGen's hosted by someone else.
Okay, here's a question. Hopefully I'll translate this properly. If multiple diagnoses are on OV and you add another encounter, can you choose what diagnosis you want for the second encounter?
The diagnosis codes will pull down from your office visit encounter. You can override them on the other encounters, so it's really up to you. We just bring down the existing ones from the base encounter by default, but then you can override or add to them also.
We are a Citrix environment. Does that have any effect on the performance of Billing Manager?
Billing Manager will run whether you're on a PC or a hosted environment, such as Citrix. We've written this using the same technologies that NextGen Practice Management and the EHR are written in. It's all Microsoft Visual Studio, so it's the same technologies and it runs in both environments.
And then here's a question. I can answer this question. What is the pricing model like for this software? So the pricing model is based on practices. So we have 3 components to the pricing: the license fee, which is a one-time fee, the installation, configuration, and training fee, which is a one-time fee, and then the third component is the software maintenance. That's an annual fee, a recurring fee, and that's your only recurring fee. If you have more, want to get more information about pricing, you can send me an email or give me a call, and we can talk through more details on that. Here's another question that came in. What about changing the payer on the second encounter? Are we able to change the payer when creating a second encounter?
Generally, if the other encounter was going to have a different payer, what I do in the current iteration of Billing Manager is to turn off using the base encounter so that you can go ahead and add that. Now today, just because no one's asked for that feature yet, most of our clients have been bringing the same payers over. The tool doesn't have a screen to do that. So today, if you wanted to use Billing Manager, you'd go back later on and add that other payer in NextGen. However, if it was something that was important to you and would be a big productivity gain, we could go ahead and look at adding a screen or a form in Billing Manager to override that payer.
And that's a good point to be made. All of the products that iTentive and DAS Health has developed over the years, the functionality that's there is there because our clients have mentioned to us that that particular functionality or would like to have that type of a feature built into the product. So we take all feedback, such as the question that was just asked, and look at it as far as adding that functionality to the application to make it more robust. So everything that you see in all of our products has come from client feedback. I think that's it on the questions. So if you have any additional questions after today, you can see my information up here and Joe's information up here on the screen. Go ahead and send us an email or give us a call and we'll get the information that you need. Again, if you'd like to have a more in-depth discussion about the Billing Manager and how it would fit within your organization, how it would fit with your current processes, we can have a discussion about that as well. So with that, we'll go ahead and close out the webinar. And again, thank you for joining us today to learn more about this product and how it would work within your organization, and have yourself a great rest of the afternoon.
Thank you, everyone. Have a great day.